So I'm going to take up really where P left off, and we have had some discussions that are in the background of this talk, but it's very much work in progress. It's slides were put together this morning once I discovered that Rob wasn't able to join us, so it's really hot off the press stuff, and some things are more worked out than others, as you'll see. So I'm just looking forward to exploring this topic with you, and hopefully this will eventually become a co-authored paper with P. But we're really at the beginnings of the project, so I need to apologize for that to you, where there are things which are not as worked out as they could be yet. So the starting point is familiar to us all by now. It's the idea that we are suffering this global mental health crisis. Just let me move the pictures of myself out of the way so I can see my slides better. 1 second. Sorry, I need to share again. Yeah, so we have this global mental health crisis where mental illness is this huge problem for us, long waiting lists and so on, like we heard about already from Charlotte. So mental illness is one of the main causes of disability and disease burden. And we know that psychotherapy can really help people. So some of you have heard this already from my introduction to the first webinar. But the problem is that we've got a demand for psychotherapy that is significantly outstripping supply. There are these huge waiting lists. So then this raises the possibility that we've been exploring in the webinar, that conversational AI, so chatbots who are implementing therapeutic techniques, maybe they're the sort of chatbots that P was talking about that are designed to do this, or they can be the ones that we're all used to interacting with. And could they be part of the solution to this problem? So even the ChatGPT, Claude chatbots, they have access to all of the data about these psychotherapeutic techniques and all of the research that's been published on it. So they know a lot about it. Maybe compared with your average psychotherapist, they know more about the kind of research that's been done on these techniques. So can we start to have them as part of the way that psychotherapy is implemented? That's what we've been exploring in our discussions so far, where the kinds of techniques that they could employ, P already explored, CBT, mindfulness, but also self-help ideas from positive psychology. You could start to have conversational AI play this kind of social role of coach, therapist. That's the possibility we've been exploring. So there are all kinds of opportunities here that we've also heard about. So there's a lot of evidence that interacting with conversational AI can improve mental health outcomes among certain populations. P already described this research to you. So there are randomized control studies showing that chatbots can help to reduce depression, anxiety symptoms, but also lots of studies that show that they can improve well-being. And we'll have Nick Jacobson next, who will tell us about the Therabot project that he's been leading, where they have indeed conducted one of these randomized control studies showing that Therabot helps patients a lot who are suffering from depression and anxiety. So we know that conversational AI can be helpful, and it can give access to care to vulnerable groups that might otherwise go untreated. So that seems like a plus. JP in his talk said compare no therapy to therapy with a chatbot, and it's kind of obvious that no therapy with a chatbot is preferable to no therapy at all. So the key question that he explored in his talk, if you remember, was, are you going to get more benefits from a human therapist than you would from a chatbot? And he made an argument that you would. because of all of the social goods that come from um, being able to enter into a therapeutic alliance with a human being, which is something that we're unable to do, at least not to the same degree with a chatbot. So that's really in the background of my talk today. I want to take up the idea that JP is right about the quality of the kind of relationship that you can enter into with a chatbot, but there might still be something like a digital therapeutic alliance that's possible. So that's what I want to explore. Uh, I've stopped being able to move between my slides. Why? There we go. So we also heard about some of the risks. I mentioned this risk at the beginning of my introduction, that there's a worry that we could end up with a kind of two-tier mental health care system where those that have access to psychotherapy get to benefit from the kind of human relationship that you can enter into with a real psychotherapist, and then the rest of the population that is unable to gain access is left with these subpar digital treatments. And I think that's a real risk that we should be aware of. So in a way, what I'm trying to do in my talk is respond to that worry um, that it's only in a patient therapist human interaction that you can get genuine therapeutic alliance. If that were true, then we would certainly be moving towards this kind of two-tier system. And so I want to try to respond to that challenge and argue, well, maybe it's not true. Um, and then Lucy Osler and Ian McGilchrist in this article that P mentioned as well argue that at least the chatbots like ChatGPT, Claude, and so on, they're designed to keep us engaged, which means that they're often sycophantic in the ways that we've already talked about. They tell us what we want to hear, and they don't have ways to push back on what we say because they don't really have any way to distinguish between from what we say, is it true or is it false? They don't have any way of knowing because they don't have a relationship to truth or to the world so that they could look at that relationship and assess whether what we're saying is true or not. So these are genuine worries, and I don't think I'm going to be able to fully respond to the worry that Lucy and Ian are raising. But I think that there's maybe another kind of worry here that is about interaction with a chatbot just being a kind of simulated reality or a fantasy that we get caught up in, which is in the background here of this worry about truth. And it's that concern that whatever relationship we can form with chatbots, it's just going to be a kind of simulated relationship that I do want to try to respond to. So I want to take up this question, can a patient form a therapeutic alliance with a machine? By therapeutic alliance, I mean that they can agree on and pursue together certain therapeutic goals, which means, with the chatbot, coming to an understanding of the kind of problems in life that you face. So can there be a shared pursuit of that kind of goal with a machine? Can there be a division of therapeutic tasks between the client and the patient that is kind of agreed upon and then acted on? And can there be this social bond or trust that forms between the patient and the machine? And I want to argue that there is a way in which all three of these conditions can be satisfied. So that's a controversial claim. I'm saying that there's something like the possibility of entering into a kind of joint pursuit of these kind of social goods. And that was exactly what JP pushed back against in his talk, if you remember, those of you who were present in the first part of this webinar. So I'm kind of responding to his concern. And I want to be quite clear that I do not think that conversational AI can replace psychotherapy with a human, nor do I think that it should. So I already responded to Charlotte with alarm, her idea that a therapy chatbot or one of these more general purpose chatbots could be better, she said, than a psychotherapist. And she was very keen to emphasize that doctors and psychotherapists make all kinds of mistakes, and that there's a way in which actually a chatbot could excel beyond the kind of treatment that you could receive from a human being. I don't think that's true, so I want to push back on that and argue that instead we could see chatbots as being used as a kind of cognitive, affective, therapeutic scaffolding. So that's the idea that I'm going to put forward, that we can see them not as tools. I'm going to say they're more than just tools. They're interestingly new variety of tool, if they're a tool at all, but they can nevertheless work as a kind of therapeutic scaffolding. And I think this fits with the kind of cases where P was seeing some positive potential in her talk. Because in all of those cases, it was a kind of hybrid setup where the AI system was not being relied upon as an agent to do the work of a therapist, but was entering into a more kind of complex ecology where this was one of the tools that was available that the client or the patient was relying on. So what I mean by a cognitive affective scaffold, sorry for the typo there, is that it's an environmental resource. So these are part of our technological environment that we're interacting with all the time. And that this environmental resource can provide support both for our problem solving, so the kind of life problems that we run into. Think of the chatbot as a kind of coach that's talking you through these kind of life problems that you have. But it can also help us with our emotional regulation. So you can imagine that a chatbot is being used to do mindfulness with, and that could be very helpful for somebody that is facing a lot of anxiety and needs to find some way to regulate and downweigh those kinds of problems that they're having. Okay, as soon as anybody joins this call, then I run into problems with my computer again. Roy, would you mind admitting Ciara? And then I'll try and get my laptop to respond again. 1 second. Roy, are you still here? I can't get my laptop to respond, so I need somebody to admit Ciara. Can anybody else see the message from her that she wants to come in? No. Okay, I have to stop then temporarily. Apologies. Can't see my cursor, which is creating a lot of problems here for me. Okay, great. Problem solved. So what do I mean by psychotherapy? So I'm just going to give you the definition from the APA, the American Psychology Association. That psychotherapy involves this communication between the patient and therapist that is aimed at relieving emotional distress, for instance, finding solutions to problems, or modifying a patient's way of thinking and acting that prevent them from working productively and enjoying personal relationships. So this kind of definition of psychotherapy, hopefully you can see that from the discussions we've been having so far, that chatbots can do all of these things. They can do each of these tasks to a better or worse degree. They can help people to find relief from emotional distress. They can help people to figure out what to do when they're suffering from grief. So Joel has done a lot of great work on grief bots. P, I think you've written about this as well. So there's no doubt that working with these kinds of chatbots can help people who are struggling with grief issues. If you've got some problems in your work life, then talking them through with a chatbot can really help. If you're facing difficulties in your personal relationships, then again, chatbots can have good advice for you. So there's no doubt that we can enter into these kind of conversations with them where they help us through some of these problems. That's not to say that chatbots are going to be able to help us with all of the very complex problems that we run into in life. So Dina Babushkina and Baz de Boer, Baz is here today, have made a nice distinction between dialogue and conversation. They argue that in psychotherapy, clients need to talk and work through their experiences, and that requires them to be listened to, recognized, and validated. And there's a big question that we can ask about each of these, whether that talking and working through process is something that you could really do with a chatbot in the way that you can with a psychoanalyst, for instance. And I think there's good reason to think that, you know, the kind of being listened to and recognized and validated that you get from a chatbot is qualitatively different from what you can get from a psychoanalyst. So I don't want to deny that. Um, they argue that to enter into a therapeutic dialogue, the AI system must be invested in finding a, sorry, what does that say? One second, I think this is an important word, so I don't want to misrepresent what Baz and Dina are saying. And I can't see it. Look, there's the idea that there has to be a commitment to a shared goal of working through what the problem is that the patient has. And there has to be a kind of intention to clarify that and work through it together, and then find a resolution to the problem. And you can hopefully see from the language that I've been using of commitments and intention, that this is a kind of relationship that it's very unlikely we can really form with a chatbot. And so I think it's correct to make this distinction between a dialogue and a conversation. Um, this is the commitment idea that there has to be this pursuit of a shared goal. So look at the word mutuality there, that there has to be something that involves a kind of reciprocity between the client and the therapist, where they're on a journey together of trying to understand what is the problem that the patient is facing and how to relieve that problem. And that involves getting a grip on the complexity of another person's mental life. And yeah, I think that chatbots can do a lot of mentalizing. They can do theory of mind and so on, but really getting to understand deeply in a way that a therapist does the complexity of another person's psychical life. I think probably that is beyond what chatbots can do. So I totally agree with Dina and Baz about this. And in the background here is a more serious concern, which I'm going to call the simulation challenge, that any AI system, because it's incapable of dialogue, is really just going to be simulating something or mimicking something or imitating something that it can't really do. And it may well be that users will then end up relating to the AI as if it were a genuine dialogical partner. But because there's this gap between having a conversation and entering into dialogue, that that relating to the chatbot as if it were a genuine dialogical partner is always going to be an illusion. It's always going to be a fantasy in the mind of the user. And I think that's a really serious problem. And it stands in the way of the idea that I put forward of digital therapeutic alliance, which requires, first of all, this kind of division of tasks and pursuit of shared goals. It requires a kind of joint action, a kind of pursuit of a shared goal where you're each doing your own, making your own contribution to bringing about that shared goal. And it's unlikely that that's something that we're able that really we can do with a chatbot, because we can't really act genuinely together with it. And so JP in his talk laid out these social goods of care, fellowship, recognition, connection, togetherness, being with, and argued that all of these social goods is not something that we can receive from the AI or the chatbot, because we can't enter into the kind of relationships of reciprocity and care that are required for receiving those kinds of social goods. I think that's absolutely right. So what you're going to get from an AI would then appear to be just a simulation or a mimicry of that. And that's deeply ethically problematic, because you're entering into a relationship where you're relating to the chatbot in a way that you trust it with your deepest emotions. You trust it to help you to explore those and to understand them. But really, the relationship that you're entering into is one which is simulated trust that you're receiving back. You're not receiving real trust back. There's no reciprocity. And so in the end, the kind of relationship that you can enter into with the chatbot is just a deceptive relationship. You're being lied to. You're trusting something that you should not trust. And that, of course, is deeply ethically problematic, especially in a vulnerable population of people who are deeply struggling with mental suffering and with the challenges of their own psychology. And they're trusting a system that they really ought not to trust, because whatever it can give them, it's just a simulation. So that is the serious challenge that I want to raise for the idea of a digital therapeutic alliance. And I don't want to underestimate the challenge, but I do want to try and respond to it and say that, well, it's not possible to fully finesse the challenge and solve it. I don't think that conversational AI is going to be able to offer us the kind of social goods that JP laid out as required for therapeutic alliance. So we can, whatever we can get from working with AI systems, it's going to be a diminished form of that therapeutic alliance. It's going to be something different. But I don't think it should be underestimated at the same time how valuable it can be. And so even though it's different in quality and it's a lesser form of therapeutic alliance than what you can get with a real human, I think it's still something. And that makes it something that's still potentially valuable. And that's what I want to explore in the last part of my talk. I want to start from Sedlikova and Trashel's idea that conversational AI isn't a tool and nor is it an agent. And I want to be quite clear about that. But it's the part of it that says that it's not a tool that I think is important for us to reflect on. So the not being an agent is easy. Those chatbots aren't able to engage in human discursive practices of giving and asking for reasons. That's what Sedlikova and Trashel say, and I think they're right about that. So they don't have agency if that's required for agency, and I think it is in a linguistic context. You have to be able to give and you have to be able to enter into our game of giving and asking for reasons. You have to be sapient, and AI systems are not sentient, and nor are they sapient. So they definitely don't have the conditions that are required for being an agent in discursive practices, even if we can have conversations with them. But nor do I think it's true that they're just tools. Um, and one reason for saying that they're not just tools is because I think there's more going on than the fictionalist account that P mentioned accounts for here. It's not just that we make believe that we're interacting with an agent that is our therapist when we put character AI into therapy mode. It's not just that we're entering into this kind of make-believe situation where the AI system then starts to play this role for us, and we understand that it's playing this role because we take this attitude of make-believe towards it. I don't think that's what's happening. It's not like you're relating to a character in a novel or in a movie when you enter into this kind of relationship with the AI. There's more going on. I think there's something that is a kind of social relation that you're entering into with the AI. And Peace work on this in her paper on collective remembering with AI, I think is very helpful for making sense of this. She borrows from Anne Strasser the idea that AI systems can be quasi-social partners. And I touched on this in responding to JP after his talk. So it's that idea that I'm now taking up that we can relate to a chatbot as a kind of social partner. And I want to try to characterize what that sociality is exactly. So going back to can we enter into therapeutic alliance with these systems? I already highlighted how that would require us to act jointly with them in pursuit of a shared goal. And it would require us to then coordinate our actions so as to bring about that shared goal. And you might think, well, because AI systems don't do things intentionally, they're not agents, it's not possible for us to enter into joint actions with them. And I think that's true. But nevertheless, I think that there's a way in which they can be scaffolded by us into becoming junior social partners. This is a concept that Anne Strasser and Eric Schitzgabel put forward, that it's not just that they provide scaffolding for us, but we also provide scaffolding for them in important ways. And it's that side of it that I want to try to explore with you. So what I'm calling quasi-sociality here is different from as-if sociality in that it involves a degree of real sociality, as P puts it. Um, and it's important there that it's a limited degree. So if it were full-blown sociality, then that would require me to say that these AI systems are agents, and they're not. I have no doubt about that. So people who start to say, well, they could be sentient or sapient in the future, I don't really have any truck for that. I think in the end, there's more to sentience and sapience than computation, because I have an embodied, inactive, ecological view of what intelligence is. So I want to be quite clear. I don't think that they can be real social partners, full social partners. But the way that we engage with them and the way that we scaffold them through our training of them, through our mind shaping, can lead to systems that are quasi-social partners. And I think that's a possibility that opens the door to chatbots being genuine interaction partners that can play a social role of being a coach, being an advisor, and this is the bit that P resisted. She said, no, they can't be therapists. I would say, well, maybe they can. Maybe they can also play that role in our lives to some degree. Not on their own, not as autonomous systems. I would agree that it has to be part of a wider hybrid kind of setup. But still, I think that there's a possibility for them to play the role of junior therapists, let's say, in the context of a psychotherapeutic practice where you have other psychotherapists that are safeguarding and acting as guardrails to make sure that the way that the chatbot is being used by the patient and the client is actually going to help them rather than harm them. So last part of my talk, I think that what has happened in thinking about chatbots is that we've not really thought hard enough about how language and conversation work. And often people think chatbots are like, they're able to construct world models or they're making internal representations to allow them to categorize things. And I want to have a Wittgensteinian perspective on chatbots where actually what they're doing is learning how, so they're acquiring a kind of know-how for following the rules which provide the context for language use. So they are becoming the kind of systems that can take part in our social cultural practices, that provide the context from within which um, language use acquires its meaning. So I'm going to start from a kind of Wittgensteinian, neo-Wittgensteinian perspective on what happens in conversation, where conversation is a kind of rule-governed activity, and where the rules that we're following bottom out in the end in action, in things that people do by acting in accordance with social cultural practices. So when we train a chatbot, I want to say that what we're doing is training it in how to follow those rules. And chatbots get very good at being able to make responses that we, as participants in these language games, see as correct, appropriate, successful, given the kinds of moves that are required by the language games that we play. So I think that we should look at the list of language games, first of all, that Wittgenstein provides. And I think you could play these sorts of language games with the chatbot. You can definitely ask it to make a joke. The joke will not necessarily be very funny. And the chatbot can sort of tell it, but it's going to miss out on all of the embodied things that P pointed out, which are really important for telling jokes as well, like the gestures and the facial expressions and the timing and so on. So there are things that the chatbot definitely can't do in terms of making a joke, but it can do some of the things. It can take part in this language game of making jokes to some extent. If you ask it to play the role of a stand-up comic, I think you would find that the chatbot would be able to make you laugh quite convincingly. Well, maybe not. Let's see. It's an experiment for you to do in your own time. So I think that we should think of the training data for conversational AIs as kind of exograms that store traces of normativity. And this is an idea that I'm developing with Eric Rietveld in a paper where we try to argue that that chatbots are capable of doing something like what he calls situated normativity, discriminating between better or worse, correct or incorrect, appropriate or inappropriate responses. So the books, the writings, the online discussions that the chatbots are trained on, they contain traces of our, as humans, normative discriminations between what counts as a good response or what counts as a bad response. So these traces are like paths that we've laid down in talking with each other. And the AI is then able to traverse some of those same paths in its training and learn about the kinds of normative evaluations, discriminations that humans make. So this is all by way of saying that an AI, a chatbot, because of its training on these kinds of exograms, can be a kind of quasi-social partner, but there's still important things that it misses. So it can make discriminations between what moves in a language game we would think of as better or worse, but it doesn't really care about our social cultural practices. And so the discriminations it's making are not coming from its care, are not coming from getting it right, mattering to the chatbot, because it doesn't matter to the chatbot. Brian Cantwell Smith makes a distinction between recognition and judgment. And when it comes to making judgments, I don't think chatbots can make judgments because they can't enter, they don't care, it doesn't matter to them about getting it right. So go back to what Lucy and Ian were saying about truth. Chatbots don't care about the truth, because they don't care about the things that matter to us in our social and cultural practices where issues of truth arise. So there's no doubt that conversational AIs are different from human social partners. And what makes the difference, I think, is that we have lived experience. We have experience of getting it right and caring about that, or getting it wrong and being, wanting to do better, feeling that the need to improve, to be moved to improve, as Eric Rietveld calls it. So wrapping up, what I try to do is argue that the Digital Therapeutic Alliance will require forming a relationship of trust with an AI. And I brought up the simulation challenge as a very serious ethical challenge for this, in that you could feel like when you enter into this kind of relationship of trust with an AI, that's something that's real, when in fact it's just a simulation and you're being deceived because there's nothing there behind the system with which you could enter into this reciprocal relationship of trust that's required for genuine therapeutic alliance. So here's how Dina and Baz put it. They say, as a conversational AI never responds to you. It may respond to a typical request as recognized and construed by its algorithm. So what I tried to do is push back on that a little bit by saying that the AI isn't just responding to a typical request. It's not just doing statistical pattern recognition because it's trained on data that is actually containing traces of what we count as uh, appropriate or inappropriate, correct or incorrect. And so through its training, it's being shaped by us into the kind of system that we can enter into a quasi-social relationship with. So I agree that the AI cannot enter into a genuine intersubjective IE relationship. That's all of the things that JP was insisting are required for therapeutic alliance. Absolutely agree with that. None of those things are what you can find with a machine. But I do think that we can enter into a quasi-social relationship with these systems. And so what they offer us isn't just genuine platitudinous statements. Why not? Why are they not just offering us these kind of typical responses to the kind of things that they're being prompted, using this ability to predict the next word in the sentence and so on? Well, because I think even though that is what's going on, there's more going on than that. They are able to follow the kinds of paths that we've laid down in talking and pick up on the things that we are normatively evaluating as appropriate or inappropriate. And so because of the training and the way that they're shaped by us to enter into interactions which are norm governed, are the sorts of interactions where you see rule following going on against a backdrop of social cultural practices. And because of that, I don't think that what you get back from an AI is necessarily just a general platitudinous statement of the sort that doesn't really reflect the listening, the being recognized, the being validated, the being understood that you get from a therapist. So what I try to do is show that maybe these chatbots can enter into social interactions with us. And so they can do more than what is suggested by this simulation worry, the idea that they're just these make-believe interactions that are going on here. It's all just a fantasy. Um, I don't think that I want to say that AI are agents. No, that should be clear, hopefully. But I do think that there's more going on than that we're just interacting with a tool that is creating this fantasy for us. So thank you.